Hello, my name is Janelle Green, and I'm about to share with you my formal paper presentation on the impacts of advanced maternal age for pregnancy. So, advanced maternal age is pregnancy after the age of 35, also known as AMA. A lot of misconceptions with AMA pregnancy is that AMA pregnancies are not natural, that all of them have to be in vitro, which is the sperm and an egg in a petri dish, and then the egg is then the fertilized egg is then inserted into mom. However, advanced maternal age mothers can get pregnant through intercourse just as well as moms of reproductive age, which is from your teenage years typically until you reach age 35. Although it's a little harder to get pregnant after the age of 35, it still is very much so possible for AMA mothers to get pregnant. As your reproductive organs age, obviously it gets to be a little harder, but very much still possible. AMA patients are considered high risk. Once you turn age 35 and you get pregnant, you're automatically considered a high risk patient, which is what this presentation is about, going over those reasons and things that can be done to ensure that your pregnancy is healthy. Being advanced maternal age literally means that these moms have a higher risk for adverse outcomes and should be closely monitored by a maternal fetal medicine specialist or a midwife throughout pregnancy. Why are advanced maternal age mothers considered high risk? Advanced maternal age moms have the highest risk for infant mortality and maternal mortality. I work in a high-risk obstetric environment, and what I've noted from working and my research is that the three biggest reasons for this are gestational hypertension, preeclampsia, and gestational diabetes. With preeclampsia, that's usually diagnosed by a high protein level in the urine, severe range blood pressures, usually over 180 systolic, and the same for gestational hypertension without the protein in the urine, but more so looking at the blood pressure. And then with gestational diabetes, around 28 weeks of pregnancy, a glucose tolerance test is usually administered to see if the glucose levels rise. With these three main diagnoses, with gestational hypertension and preeclampsia, we're concerned about the blood flow from placenta to baby. If that pressure is high, usually the baby cannot get the nutrients that the baby needs, the correct blood flow in order to develop and grow properly. With diabetes, that tends to affect the size of the baby, with having large gestational age babies, small for gestational age babies. And because of these disease processes, the physician might determine that the baby needs to be delivered early via C-section. And with C-sections, of course, we know that there is risk for bleeding as well as postoperative complications. How does AMA affect the fetus? So going back to delivering early via C-section, the physician may decide that the baby is safer outside than inside of the hostile environment that it's been growing in. So if the mom does not reach 37 weeks gestation, we now have a premature baby. With prematurity, the baby most likely going to the NICU, and depending on when that gestational age is, the baby may have a longer NICU stay. The baby may need extra help breathing via a CPAP, or the baby may need to be intubated. That alone is very stressful to the baby and can hinder development. Also, going back to the placental insufficiency and the blood glucose complication, the baby, that affects development along with the baby's blood sugar once the baby is born. If the blood sugar is too low, there may be complications, as well if it's too high. And that directly relates to what was going on inside mom can affect baby with being delivered early. So all that sounds really scary. So you wonder what you can do to improve your outcomes. So with improving your outcomes, the most vital thing for the mother to do is establishing obstetric care within the first trimester. It's very important that once the mom finds out, she's go ahead and start obstetric care with a physician that she trusts so that a transvaginal ultrasound can be done to already see how the baby is developing. Necessary blood tests may be done as far as determining if anything genetically is going on with the baby that needs to be addressed. For example, there are different blood tests that can test for Down syndrome, trisomy 21, and other other developmental complications. Also, lifestyle changes may need to be addressed. If mom is a smoker, smoking cessation needs to begin, as well as any kind of alcohol consumption. It's beneficial for moms to be active during pregnancy, but it's a good idea to speak with your physician about how active the mom needs to be during pregnancy or what kind of things are safe for the mom to do. So, in conclusion, we discussed that fertility decreases with age. However, pregnancy after 35 is very possible. Advanced maternal age moms and their babies are more at risk for health complications. And the best thing for the mom to do to decrease any kind of adverse outcomes would be to establish care in the first trimester and make necessary lifestyle changes to better benefit baby and herself. So thank you very much for viewing my presentation, and that is it. Where